we are going to talk briefly about ergonomics. And ergonomics and posture are very closely related. It's not exactly the same thing, but we'll talk about it. The learning objectives for this part are defining ergonomics, and it's important in healthcare. Lots of times in the clinic, I help people figure out their workstation setup. We're going to identify the four basic principles of ergonomics, understand the role of the PTA in ergonomic assessments, and apply ergonomic principles to prevent workplace injuries. So, what is ergonomics? It's an applied science concerned with designing and arranging things people use so that people and things interact most efficiently and safely. The idea of ergonomics kind of came out in the mid 80s, and they just said, oh, we need to make things that people can work with. Oh, like, oh, big revelation, right? The key points of ergonomics are a focus on prevention. Most work-related musculoskeletal injuries can be prevented if you think about it in that way. Employer responsibility, so the Occupational Safety and Health Administration requires safe and healthy workplaces. OSHA develops the rules basically, and then NIOSH, the National Institute for Occupational Safety and Health, comes up with the guidelines following the OSHA's recommendations. It's definitely cost effective. It reduces workers' compensation, it increases efficiency, and people don't get hurt. So ergonomics isn't just about comfort, it's about safety and preventing injury. So in a past life, when I worked in IT, I used to do ergonomic analysis on people's workstations. And the way it would usually happen is somebody would get injured, and then the safety department would call the IT department to have me come down and do ergonomics. Well, if we had done it ahead of time, then that person probably wouldn't have gotten injured. So I did suggest to management at one point that, hey, why don't you just have me analyze everybody's workstation for ergonomics and we can prevent these injuries? And what did they say? No. So there you go. But at Whatcom, we have an ergonomic specialist, Brenda Hennick, who you all know. So if somebody needs their workstation analyzed at Whatcom, they can call Brenda and set up an appointment, and she can recommend what changes need to be made to your workstation to make it more ergonomic, which is great. I got to get her over to my workstation. I moved offices last summer, and the new desk is not that ergonomic. So we'll go down to we'll either with someone's individual laptop, or we'll go down to the computer lab and just practice setting up an ergonomic workstation. There's a little handout in your lab manual about that, which is kind of nifty. So the four basic principles of ergonomics: neutral posture. So when we're talking about posture, we're talking about neutral posture. So the joint positions are in the mid-range of motion. Grip types are important. So if you're using hand tools, whether they be computer mice or routers or something like that, manufacturing tools, grip selection is important, and the use of the tool is important. Muscle fatigue, managing back and neck pain and fatigue, and proper lifting, safe lifting mechanics and techniques. And when are things a team lift and when are they not? So neutral positions allow muscles to generate maximal force at their normal resting length. Awkward positions, it fully flexed or fully extended or bent over, lead to faster fatigue and increased injury risk. So our computer workstation setup. The key positioning elements, the top of the screen needs to be at or below eye level and 20 to 24 inches away from your normal seated position. A lot of times what I see is the monitor's way too high, the monitor's way too low, or it's too far away. I have rarely seen where it's too close, usually because you're trying to do other stuff on your desk and the monitor's too far away. The keyboard and mouse, the elbows should be at 90 degrees and the wrists in neutral. The chair, your feet should be flat on the floor and thighs parallel to the ground or just slightly above parallel. So slightly higher than parallel. Lumbar support to maintain the natural spine curve is ideal in the chair. So this setup works because it prevents neck strain from looking up or down at the monitor. One of the things that happens a lot is people get progressive lenses or bifocals, and they end up having to look through the reedy part of their glasses, and they tilt their head back, and so they end up having neck pain. One of the things that ophthalmologists and optometrists will do is they'll write you a prescription that has the reedy part up higher. They call them computer glasses. And it makes it so you don't have to tilt your head back. That is one way to do it without arranging your position differently. The other way is to arrange it so the computer is a little bit lower, so you can, the monitor is a little bit lower, so you're looking through the right part of your glasses, so you can actually read what's on the monitor. You want to maintain the setup that we talked about here, maintains neutral wrist position to prevent carpal tunnel by putting compression on the median nerve. It supports proper spinal alignment, reduces shoulder tension and forward head posture. So if your desk is too high, your shoulders are scrunched up. And I think that's the problem with my current workstation setup in my office. At home, I have a standing desk, so that is, and a perch stool, so I can have a lot of different positions. The suggested setup allows frequent position changes. So monitor too low is a common mistake. Keyboard too high, causing shoulder elevation, no lumbar support, causing a slouch posture, and then the bifocal thing. So in ergonomic training programs, usually they assess ergonomic checklists that are based on the four principles that we talked about. And for certain jobs, you need job-specific training in easy to understand terms. The ergonomic training wants to collect data and job analysis to determine the scope of ergonomic training and fix problems. So employee remediation techniques and replacing problematic equipment. And then, of course, you want to assess the effectiveness. And the idea is you want to promote a healthy workplace. And if workers are injured because of ergonomic issues or any other reason, you want to accommodate returning workers with modified duties. Maintaining an open dialogue between a committed management and workers is important for having ergonomic programs in the workplace. Not all management is committed to spending the money it takes to get people to analyze your ergonomic. So that's always an issue. It always comes down to that, doesn't it? So our role in ergonomic education, hospital body mechanics programs, annual education for facility workers. I've done this quite a lot in one skilled nursing facility where I worked. I used to train all the new incoming nursing assistants and nurses. I trained them on transfer technique and just general ergonomics. It was great. It was really fun to do that. I also, in the hospital where I worked, we had the annual education, and during COVID, we couldn't do it the way that we normally did it, and so we had like a body mechanics fair, sort of. So we had little different workstations, some with lifts and some with different transfer techniques and everything. And there was someone from the PT department at each station teaching all of the other employees how to do things right. So that was fun, even though it was during COVID. So audience-specific training content is going to vary by job duty. So when we were training the nurses, a lot of times we were talking about transfers, scooting people up in bed, using lifts properly, that sort of thing. For like the office staff, the front desk and referral and everything, the billing staff, their computer workstation needs to be set up properly. At the last clinic where I worked, everybody had high-low desks, including the people at the front desk. And so you could do it high and stand, you could do it low, you could adjust for whatever you wanted that day. Transfer training for nursing assistants and nurses and anybody else who's transferring patients. So for healthcare workers, they need to know basic anatomy, basic spinal anatomy and injury mechanisms, identifying risks in work-related activities, posture training, lifting techniques, proper use of equipment, so mechanical lifts and gait belts, And fitness education, the importance of physical conditioning for that very strenuous physical job that they have. So you can do a clinical assessment using detailed checklists. OSHA puts out a really good checklist that I actually like. I will sometimes give it to people to evaluate their own workspace. That's the self-assessment part. Job analysis is a comprehensive evaluation of tasks and environment. And a lot of OTs who do functional capacity training do this kind of job analysis, very detailed, every little thing you do in your job. So the key assessment areas are, of course, workstation layout, tools and equipment, the environment, and the job demands, the physical requirements and tasks that are demanded by the job. So common modifications are standing desks, like I was saying, or adjustable desks, high-low desks. Keyboard adjustments, maybe there's a keyboard tray to get it down a little bit lower so your shoulders can be neutral. Seating changes, task sequencing, patient handling, equipment, and vibration dampeners. If you're using vibrating tools, that can really aggravate your for carpal tunnel, vibrating tools. Sometimes just the way you hold the tool and the way you do the job that you do with it can make a difference, ergonomically speaking. So the essential ergonomic tips are avoid static positions, especially prolonged static positions and repetitive motions. Plan your movement before you start to move things, how's it going to work? Make your plan. I joke around all the time and I say we're physical therapy and furniture moving. If you work in inpatient, you're always moving the furniture in the patient's room so you can do your session in there. If you work in outpatient, you're always moving furniture too. So physical therapy and furniture moving. So plan your movement, make sure you know what you're doing and it's within your physical capacity to do it. Reduce reaching, so you're going to rearrange your workspace to minimize overhead reaching. And sideways reaching, that can put some stress on spinal structures. So maintaining a neutral spine while sitting by using lumbar support, minimizing forces. So pushing is easier than pulling and using mechanical aids. And a lot of skilled nursing facilities, the nurses go around with their med cart and they push the cart to each patient's room and give them their medications. So if they push them rather than they pull them, it's a lot less force on your body because you can use your legs to push it. Proper height workstation so you can maintain posture. Standing strategy, so alternate foot positions, padded mats can be helpful for taking the pressure off structures. So being able to switch your position so you're not stuck in one static position, that's pretty important. In my home office, I definitely have a lot of different positions I can be in. I can be standing, I can be sitting, I can be sitting on different supportive surfaces, and that's important. So pressure relief on contact points, if you have the little mouse pads and the little keyboard pads can reduce pressure on contact points. And even if it's not a computer workstation, other areas where you might have contact. So movement is really important. So they say sitting is the new smoking. It has led to the increased use of standing desks, but prolonged standing isn't the answer either. So you have to be able to change position every 30 to 45 minutes and take stretch breaks between tasks. And I tell you, people are bad at this. But it's important to take those breaks. Position variety. If you're sitting, stand and extend. If you're standing, flex forward if it's pain-free for you. So just varying your position so you're not doing any position for a prolonged amount of time. Brief walks around the office periodically, depending on what your job is. Some people have jobs where they're like chained to the phone and they can't. So then I think it's on their employer to give them breaks so they can get up and walk around periodically so they're not just chained to the phone. Targeted stretches like wrists, hands, and fingers during computer work. Sometimes I recommend to people that they set an alarm on their calendar. So every so often it reminds them to stretch. That's always a good thing to do. So a healthy work environment allows frequent position changes and minimizes high risk activities and offers opportunity for motion throughout the day. Of course, in physical therapy, we're moving all the time, but not everybody's as lucky as we are. So, as a PTA, remember that most musculoskeletal disorders can be prevented, work related. So, prevention is really important. Even if you're fighting against management to get some prevention, it's a good fight. Fight the good fight. The four principles of ergonomics: neutral posture, proper grip, managing fatigue, and safe lifting. Um, Providing targeted audience specific training to educate people on proper ergonomics, and assessment skills using checklists and clinical observation and sometimes measurements, encouraging frequent position changes. So think about how we're going to apply these principles when you're setting up new patient treatment areas, or you're training patients on home exercises, or you're educating patients for their return to work after their injury, or you're maintaining your own workplace safety. So it's not just everybody else, it's you too. So your role in ergonomics extends beyond assessment. You're an educator, you're an advocate, and you're a model for workplace safety. So demonstrate good posture and good setup and safe lifting and all the things that you know you should be doing because you are a model for workplace safety. So think about the four basic principles of ergonomics. Why neutral joint positioning is important. What should be included in ergonomic training for healthcare workers? And I hope that someday you will get the chance to do this. Um, how often should workers change positions during the day? And what's the most efficient position for using a screwdriver? I don't know how that one got on there. It's from the book, but um, or what's the most efficient position for using a computer? That's probably more to the point in our, unless we're working on a wheelchair or something, and then maybe you are using a screwdriver, an Allen wrench or something. So think about how you can apply these ergonomic principles in your future practice as a PTA, and what role will you play in preventing workplace injuries? So ergonomics is a really interesting field. If you want to get certified in ergonomic analysis, there are certification training programs available, and it's a really interesting area.